So hi, my name is Rini and we are basically from Chandigarh. I got pneumothorax. So basically how it started, I got a sudden pain in my right hand side of the chest. And then after the pain lasted for maybe for half an hour, 45 minutes. And then there was breathlessness for few days. So first time it happened in 2019, we went to a prominent hospital. We are from Chandigarh, so we went to a prominent hospital in Chandigarh. They inserted ICD and the air was taken out, and I was good to go in 4-5 days. So everything went well for 4 years. Again, I think April is not a good month for me. So again, it happened in April 2023. 8th of April it happened. Again, a sudden chest pain, and again the breathlessness started. So we went to the same hospital again, and again the procedure was done. ICD was inserted. I got discharged from the hospital, came back home. The day my suture was supposed to be removed, I again got pain on my chest. I was really scared, and it happened again. So third time it reoccurred. So, but when we went to see the doctor, he said everything is fine. We got the X-ray done from outside, and he said there is nothing in the X-ray, so you are good to go back home. So we were like, okay, theek hai, chalo, let's go back home. But over a period of like 1 week, the breathlessness was there and I was not recovering well. So we started searching on our own what is the cause of this problem? Why is it happening again and again? And why did it happen for the second time? We were not aware that it has already occurred the third time. So we were just searching for the cause. Why did it happen? And we came across the video of Dr. Harshvardhan on YouTube.
Hi, I'm Dr. Harshvardhan Puri. I am a thoracic surgeon and lung transplant surgeon in Medanta The Medicity, Gurugram. So today we'll be talking about a disease which is very dreadful, known as pneumothorax. What is pneumothorax? Pneumothorax is the accumulation of air between the two layers of pleura, that is visceral pleura and parietal pleura. This is an acute emergency. So whenever I get a call from some part of India that a patient is there who is having pneumothorax or the diagnosis has been made. So the first thing I tell the patient to go to the nearest emergency, get a chest X-ray done, and this is the most basic investigation. On a chest X-ray, you can diagnose a pneumothorax very easily. And after diagnosis of the pneumothorax, the first thing which should be done is putting in a chest tube. After putting the chest tube, the patient should be referred to a pulmonologist or to a thoracic surgeon. So these guidelines of treatment of pneumothorax are governed by British Thoracic Society guidelines, which we also follow. So today we will be talking about one such patient, Mrs. Rini, who is a resident of Chandigarh. So she had these recurrent episodes of pneumothorax for which multiple ICDs were inserted at multiple institutes. After second or third episode, she was referred to me as a case of recurrent pneumothorax. What we thoracic surgeons do, that we treat it completely from the base. So what we do a CT scan of these patients, see the abnormalities in the thorax, in the lungs, and then we prepare these patients for a surgical procedure known as VATS, or video assisted thoracic surgery. In this procedure, we make a small holes in the chest, 3 small holes, and do the whole procedure by these holes. What we do, we take care of the air leaking point or the blebs or the bullae by stapling these areas. And to avoid recurrence in these patients, we either do a complete pleurectomy in these patients or a TAL pleurodach. So a pleurodesis is must in these patients to avoid recurrence. So these are the 2 steps of the surgery we perform on this patient. And because this surgery is performed from 3 small holes in a minimally invasive method, so the recovery of these patients is excellent. We follow a ERAS protocol also in these patients, and these patients are discharged in 3 or 4 days, and they return to their normal activity, normal life in maybe in 7 days, and the problem is resolved completely from the base. Thank you.
The experience here was so wonderful. The team was so good, and the recovery was so fast. I mean, I came back from the OT, and next day in the ICU, I was sitting on the chair, and pain was also not that much. So recovery was very quick. Within 4-5 days, I think total 7 days hospitalization, and I'm back home. So I'm so happy. Like today, I just came back for the checkup, and my recovery is good. I'm, feeling so healthy. and so happy with the team. Overall, experience was amazing. Nursing staff, doctors, their team is wonderful. And anything, if something happens, if something like this for the lung surgery, whatever, I think this is the best place which we all can, come. And now I know, like, if in future anything ever happens, where I have to come. So thank you team Harshvardhan and Dr. Arvind. Thank you so much.